Well, good morning, everybody. It's a privilege and a pleasure to be here in Berlin. And I want to spend my time with you just to talk a little bit about what we're doing in the UK, what we're doing in the NHS, and how we're taking this Global Standards Initiative forward. Just a little bit of an overview of the National Health Service. We employ 1.6 million people. It has been reorganised over recent years, and I work in a foundation trust, and across England we now have health provision provided by foundation trusts across the UK. As you can see from this slide, it's a huge organisation that we've got, and hospitals need to work together more collaboratively. The main tenet of the National Health Service is still free at the point of care or free at the point of treatment for individuals, a tax-funded system, and we're accountable to Parliament. And myself, I'm designated as an accountable officer, so I could be called by the Public Accounts Committee in the UK government for any actions that take place within my organisation. I am accountable through the structure that we currently have. Having said that, the Commonwealth Fund said that the NHS is pretty efficient in what it does and for the outcomes that we provide, but nevertheless, as you'll see on later slides, we have a huge financial challenge that we need to deal with. And I see the GS1 initiative and Scan for Safety that we're putting in place is a significant way forward, not only improving quality, but delivering efficiency as well. But like most European, well indeed countries worldwide, there is an increased demand on the National Health Service. Huge technological advances, and the previous speakers have been talking about innovations that are yet to come in the world of technology. It's improved diagnosis and treatment, and it is the biggest driver of the increase in costs that we face across the world, and certainly in the UK. We have an ageing population, multiple long-term conditions amongst the elderly. The population of the over 80-year-olds will significantly increase, as well as an overall growing population. So we have increased demand at the same time. We have increasing expectations from the public. So we have increased financial pressure on the National Health Service. The current leader of NHS England, Simon Stevens, in his report said that we would need 30 billion over the next few years. So by 2020, it would need 30 billion to keep the NHS doing the things that we've always done and coping with the increases in demand. The UK government has promised 10 billion. It's put the money in up front, but effectively it's already been spent. So the 20 billion financial gap is what we in the foundation trusts, working with our commissioners of healthcare for the population, are looking to see how we can deliver a better quality and improved outcomes through greater efficiency. At the same time, we need to make sure that the NHS remains safe and indeed improves its safety record. And I will say a little bit about that in a minute. So we need productivity increases, but as you can see from the slide, what we're looking for is not what we've been able to achieve over the last few years. Challenges in patient safety, which we must make sure is paramount. And I highlight on this slide the breast implant scandal, which, as you will be aware, had massive implications for patients and organisations across the globe. In my own trust, we were a leading provider of, and we are a leading provider of hip replacements, and the metal-on-metal scandal cost my individual organisation just £23,000. The reason I highlight that is if we had had Scan for Safety or GS1 barcoding in place, I could have saved that money by having instant access to real data, which would have told me which patients had had the metal-on-metal implants, which surgeons had put those into place, which location that they'd had it done in, which one of my hospitals it was. So I highlight that because the importance of patient safety and what we can do and what we will be doing in the UK by implementing this technology has far-reaching implications, not only for efficiency, but as I say, on the quality for patients and the reassurance it can give patients. So, as I think was said earlier on one of the video clips, the Department of Health has mandated the NHS. Their e-procurement strategy in 2014 is to try to get full compliance across all acute trusts, foundation trusts such as my own. But also, providers and suppliers must work together, as we've heard. The NHS, in procuring supplies to the NHS, the standard terms and conditions which we deal with suppliers in every day, those conditions have been updated to make sure that barcoding is part of that. And there will be the mandated use of GS1 standards in terms of scanning patient, product and place, being able to do that as an absolute minimum requirement. So, in the UK, there are 6 foundation trusts that are leading the way in putting this new system in place and making sure that we can introduce right across the UK. My own trust is in the north of England, and there is a cluster of 3, as you can see from the slide. North Tees, the Leeds Teaching Hospital, Derby Teaching Hospitals, and we have a speaker later from Salisbury who is here as part of the programme, and then 2 trusts in the southwest, in Devon and Cornwall. So we are leading the way for the UK in taking the initiative forward. This is my patient safety triangle. I also use it as my strategy triangle. We do update it every year. But in my trust, patient safety is at the centre of our vision, is at the centre of our strategy. And Scan for Safety, the GS1 standards, supports this vision. The pinnacle of the triangle is the patient. The patient is paramount. And although we have financial problems in the NHS, which I've touched on and which we are looking to tackle, we mustn't compromise patient safety as we take this initiative forward. And we mustn't ever do that, because patients and the service that they get is what we would want for ourselves and our families. So the transformation in the trust, the coding that is taking place, the barcoding, and as I think most of you in the audience will be pretty much aware now, all patients will be allocated a wristband and it will be scanned. The products that we give patients, the drugs, the medical supplies, the theatre products, whatever that's going in and on and around the patient that we use will be able to be scanned because of barcoding by the suppliers. And that will improve stock control, inventory management, and indeed deliver some efficiency savings. All locations throughout the trust will also effectively be catalogued, which it has in terms of points of delivery of healthcare. My medical director, Deepak Dwarkanath, he is a recent appointment and followed a long-standing medical director that we had for many years. But this is about doing the right things for the right patient at the right time. And the other thing to say is, right across the UK, supported by GMC, supported by the Royal Colleges of Medicine, we are looking to do deep dives into an initiative which is called Getting It Right First Time. And there are 32 clinical specialties that are being looked at in detail to make sure that we can benchmark between hospitals, benchmark between individual clinicians looking at best practice. And Scan for Safety will help us to be able to populate the data for that initiative going forward to make sure that we focus on the right thing at the right time. We still have too many adverse incidents in the NHS. We still have to pay out, and we still do pay out, over £1 billion. Over £1 billion are paid out in clinical negligence claims throughout the UK for things that we get wrong, that with this system would go a long way to making sure that those errors are eliminated. But the other part of this is about a paperless hospital. Some of you might be lucky enough to work in a paperless hospital, but I don't. But it's an ambition that I've got, using technology right across all areas of clinical practice to make sure that we can deliver efficiency in that way and improve safety at the same time. So this is the patient journey. The patient arrives at hospital, is barcoded, patient is given medication, and all that is scanned and documented. At the same time they return home. But if in the example of the PIP implant or the metal-on-metal issues, if there is a national recall, if it's a particular product that's faulty, as well as something that we may have done that might be causing something adverse, if we've learned, what's happening in other hospitals, what we can do is, through the system of barcoding, immediately locate what happened, when it happened, who did the procedure. But the main thing for me also is to be able to reassure the patient whether they are affected by this particular issue or not, because we will know immediately. And as I say, on the metal-on-metal scandal, it took us weeks and weeks and weeks of going through medical records and £23,000 of cost in being able to do that, which in the future will not happen. And it obviously meant that patients had to wait before we could reassure them. Scan for Safety is anticipated to deliver 2.6 million worth of benefits for our trust, and this is the time that we can put back into healthcare by releasing nursing hours to look after patients more effectively, giving more time for care, as well as delivering efficiency savings, as well as better stock managing. And then when point of care scanning really gets going right across all of our points of delivery, we will really reap the benefits. So it's the foundation for integrated patient care. The identification and traceability for every person, product, in every place throughout the hospital has huge patient safety benefits and financial savings. And the last thing I would say, before I open it up for a few questions, if there are any, essentially safety, quality, and financial efficiency go together. It's not an either-or. And I've seen it. If we get things right first time, if we don't have to readmit patients because something has gone wrong or they haven't had optimal care, then we will save money as a result. So it's better outcomes for patients. It's a more efficient and safe hospital. And that's the goal that we strive for. And I'm passionate to support GS1 in the work that they're doing, the barcoding, and the initiative in the UK, which is Scan for Safety, which will transform what we do in the National Health Service. Thank you.